Welcome to Tech About Town, brought to you by Communitech and Elevate IP. I'm Alex Kinsella.
And I'm Rosie Del Campo.
We're back in the studio. It's been a little bit, been a minute.
It has been a minute.
Also, we air these out of order.
We do, but that's cool.
That's fine. Today, it's a bumping day, if I do say it myself, here in the hub. There's the Fast Track Health showcases happening. It's going to be live streamed as well, so you can catch that on, I assume, the YouTube channel later if you're not watching it right this second. How are you doing?
I'm doing great. These Fast Track Health showcase events are always great to watch. I'll be sitting in and writing a story about it because so many founders come through and pitch their solutions, and they all have a great story behind each one of them, and they're really trying to make a difference. They're trying to eliminate fax machines for starters.
That's a big one.
Let's just start there. And
fax.
really, in all seriousness, they're trying to optimize the way that we do healthcare in Canada, which really impacts the bottom line. But at the end of the day, it impacts patient care, and we all need to be cared for.
We have two guests from the showcase, so tell us a little about our guest today.
Yeah, we're excited to welcome Jean-Pierre JP Iskander. He's the CEO and founder of Sifio Health. And also joining us is Stacy Sobering, who works with us here at Communitech. She's a program manager for Fast Track Health.
This is an interesting one, too, because I've interviewed JP before, so I knew already a little bit. And that's the second time that I've interviewed someone who's on the podcast, so I get a little insight.
Right. So you know all of the cool things that he's up to, but
I learned a lot, so a lot of new stuff, which I was kind of, it's always good. So welcome to the studio. Today is a special day here at the Hub because we're having the Fast Track Health Showcase. That's why you're here, and we figured we'd kill two birds with one stone.
Great.
And have you on the podcast. So welcome today.
Thank you.
Can you start just a little bit about Sifio Health?
Well, Sifio Health is an AI-powered platform to help hospitals and providers to optimize their workflow. It's a tool to help them schedule and plan in a much smarter way, anticipating what can happen in such a chaotic environment.
And so the way that I always kind of looked at it when you were telling me about it before, because I've interviewed you before about it, right? Like today, if you watch a medical drama, we're watching The Pit right now on Max. You know, if you subscribe to Crave and the Max additional $9.99 a month, you got to pay to watch The Pit. It seems like they're constantly struggling to find rooms for people, right? So if they're in Emerge and they're trying to find a room, and then they're trying to find a room upstairs, whether it's an operating theater or whatever, it's dramatized, obviously, right? It's not really like that. Most surgeries are planned. There are obviously emergencies, but your solution is looking at real world hospital situations and saying, hey, you don't have the staff moving in the right way. Like you might have nurses who aren't working, or you might have physicians who aren't doing something, or anesthesiologists. Is that the kind of thing, and like optimizing how they work?
That's exactly it. The best way is maybe to share with you a story, a personal story. This lady called Sarah is a very good friend of ours, and on December 12, 2024, 2023, she had to go through a hysterectomy, and she was got into the hospital, and she was turned back at registration. The hospital staff informed her that her surgery is canceled because they ran out of beds in the hospital for her post-operative care. She had to reschedule the surgery for 4 weeks later, and she had to continue on suffering with her ailment for an additional 4 weeks after waiting for 20 weeks for the surgery. And the reason of that is that hospitals run out of bed because the emergencies can fluctuate in and out, and the resources can fluctuate in and out of what they have. As a matter of fact, her story is not that unique. 1 out of 7 surgeries are canceled on a day in and day out basis. So it's a very fluid situations in the hospital environment. There's a lot of peaks and valleys in terms of the resources and the demands required, and it requires a lot thinking of what to do about it. How do you calculate the math, and how do you manage with the resources that you have today with a fluctuating demand that you might be walking in from an emergency, from watching ER or others?
I always think of of course, I only know from medical dramas, but when you watch a medical drama, everyone seems really busy, and they're always complaining about having to fill out charts and fill out systems. So how do you get them to kind of How do you get that information?
The interesting thing about information and the healthcare system is that there is plenty of information. There are things that are tracked and required to be tracked, and there are multiple systems. But the main challenge is not really the information. The main challenge is integrating that information and mining that information for insights and making them actionable. So we are actually utilizing existing information. Every interactions with the patient is recorded somewhere, is recorded in a system, and it's actually required to be reported and becomes part of their charting and part of their journey. And we are tapping into those existing sources of information, which is plenty, and it's just a matter of knowing how to integrate into them, which is not necessarily an easy task.
Right. Why isn't it easy? Like, I hear a lot about healthcare being a really tough nut to crack. They have their systems, they have their ways of doing things for years. So that's where you come in, because you're trying to optimize so many things and for these organizations, these agencies, these institutions. So how can you help them see past that barrier? And what is that barrier? What's the biggest challenge for them to get past those challenges and really start integrating these technological solutions that are going to make everyone's lives easier?
That's a great question. The biggest barrier that not only startup find within the Canadian ecosystem, but around the world and in hospital environments to implement new innovation and technology is the silo mentality. Meaning that we bought a software or we have a solution and we are implementing here, it's ideal here, whether it's legacy or whether it's a new technology that we implemented here, we did not look at how it might be impacting other areas, other departments, or how other departments are going to tap into it. And sometimes that's a product of the vendors. There are 3 large vendors when it comes to electronic medical records around the world, and they protect their turf by making sure that very few people can integrate into their platform, and they promise their clients that they are going to perform and optimize and evolve with their needs. But their focus can be very different than what a startup can bring and what can they focus on. And just on that one particular one, I just want to pull onto another piece of it. Canadian healthcare system is extremely unique versus anywhere else in the world, where we are actually, we are taxpayers, pay into the healthcare system. But when you're looking at the patient going into the hospital, and from a business perspective, they are really a cost center to the hospitals. Any resources the hospital is going to provide for the patients is part of their cost structure. Versus in a lot of places in the world, especially in the States where a lot of those electronic medical records are and the companies are, the patient is a revenue center. So those systems are built to maximize revenue. And sometimes when we are implementing them in Canada, we're not really looking at that revenue piece. We're looking at trying to optimize for the limited resources that we have to get as many patients across, and they're not necessarily geared towards that. So we're filling in this void with Canadian technology to bring in that optimization that is more geared towards our system, but we are facing the barriers of those major systems that are embedded within the hospital system.
Right. So you're optimizing things from an operations standpoint. So how does that translate to changes, improvements with respect to patient care?
Another great question. One of the biggest things that we find in patient care is they're scheduling time in a surgery department, just like I mentioned the story of Sarah. So the patients are giving a scheduled time, and they wait for a long time for it. We can share with you statistics that you can see throughout the hospitals. There are likelihood that if the surgery is scheduled on Thursday and it requires a surgical bed, that the surgical bed would not be available because there are very few patients are scheduled on Friday require surgical beds. And there are a lot of patients scheduled on Monday, Tuesday. So by the time Thursday comes, the surgical beds available for post-operative care are usually filled. we see these patterns. We allow the technology to detect these patterns earlier on, and we embed it into the scheduling and planning so that the peaks and valleys of those patterns of how they are scheduling surgical beds required post-operative is that they are smooth. Instead of having peaks that cause bottlenecks or valleys that cause waste in resources, we smooth them out. We let the software and the programming smooth them out so that you don't have bottlenecks in the system and you don't get people like Sarah disappointed that they have to walk away from their surgery.
During the COVID-19 pandemic, backlogs were a big challenge, right, in healthcare. But I feel like the pandemic was actually, it turned out to be an opportunity for you to bring in your technology.
Absolutely, and the backlog issue has not been resolved yet, and it still is a critical issue. We're still talking about over 1 million Canadians are still on a wait list, and in most cases, they are there for more than 6 months, waiting for their surgery. The COVID was a blessing in disguise for technology into the healthcare. Technology has been trying to infiltrate into healthcare for so long. We've been hearing statements like axe the facts, because still a lot of requisitions are going through the healthcare using paper and analog means, and still using fax machines. So we find that there was a huge appetite and shift, and a lot of the barriers have fallen during that were established have started to fall during COVID. We're advocating and we're looking at technologies to do patient visits online for so long, and with COVID, it just became a reality in a matter of seconds. And all the issues with privacy and all the issues with billing and all the issues that have been put forward as barriers for digital clinic hours and digital patient visits have been disappeared in a matter of seconds with COVID. And we're finding that there's a huge appetite to consider technology, but notwithstanding, there's still lots of barriers in terms of how to get that technology integrated and deployed within the healthcare system.
And the thing you talked about that shocked me and had my jaw on the floor here was I never thought about patients in Canada being a cost center versus a revenue center in the States. When you're looking at that, then where are your customers today? Are they primarily in Canada then? And then secondary to that, are you looking at the U.S. as a market?
Absolutely. So primarily Canada is where our market is. This is where we started. Knowing that we are going to be expanding globally, and next is our neighbors in the States. Canadian technology and looking at optimization, we are still holding a lead worldwide in terms of our cost per patient and our cost structure per patient. I worked extensively with folks in the States, and I could tell you with confidence that they were quite amazed at how little it can be costing in Canada to do things versus how much it is in the States from that perspective. So we know that if we are actually even bending the cost curve here in Canada with technology, we are going to take it much further out in the States and around the world. So Canada is not really bad as far as testing market when we're talking about optimization and specifically cost reductions and efficiency improvements, because we know we are already somewhat efficient, and any technology that is tested and proven here will actually take us much further ahead globally and across the border in the U.S.
So JP and Sifio Health are taking part in Fast Track Health, and Stacey Sobering, Program Manager at Communitech, is here. Stacey, you've seen quite a few startups come through the program. What really stands out to you about companies like Sifio Health and others that have come through?
Yeah, it's so amazing to just see the optimism that we still have for the system to really, understand that we are very blessed in this country to have the healthcare that we do, but there's so many rooms for improvement. And it's just enlightened me personally, honestly, to a whole bunch of underlying issues that I didn't even realize existed. So in talking to JP, for example, we were talking about how surgeons are amazing at surgery, but they're actually not that amazing at guessing how long surgery is going to take, right? And so how can we just take that guesswork out of the medical system? And it's true of so many of the companies that I see that are just taking really different approaches and also bringing together this community of healthcare providers who are really invested and willing to volunteer time to meet with these companies and learn about what they're working on and give feedback because, despite what we've been through with COVID and all of these challenges, people are still optimistic and still hopeful about, the opportunities to improve.
And JP, how did you hear about Fast Track Health and what connected you to that program?
I'm well connected to the community tech since we started. I'm an engineer by background and been watching all along the development that's been happening here in the in the Waterloo regions and as well as with technology development in the area. And we've been part of the accelerator program, and we've been winning multiple competitions that is federally funded to get our technology into the hand of providers here in Canada. And Community Tech has been always part of that for the last couple of years that we have been we've been affiliated with the Accelerator program and the Waterloo Region Tech Hub.
So you're participating in the showcase today, happen later in the afternoon. Looking forward to it now, like, do you have expectations or kind of goals for what's going to happen? Like, is it connecting with other healthcare providers? Is it connecting with potential partners?
All of the above. Well, first, it's nice to connect with a large community with the main focus on improving healthcare with technology. The challenge questions and the challenge itself that brought us here today that we had to answer as part of the competition to be on the showcase highlights the need of technology to improve our system, that regardless how well we're doing and how many millions of patients that we're treating, we could talk about the problems, but at the end of the day, we need to know that physicians and hospitals and providers and our money is being used to treat millions of patients every year that walk through our hospitals and walk through our health game. And it's nice to see that we're not just celebrating that and stopping there. We're actually looking at what's next. How can we improve our system with technologies that are available to us? What are some of our the challenges that we can look at working together to improve? So I'm really excited to be here because it's just another means of connecting with like-minded folks, with like-minded community, and not just within a particular geographical region or within our province in Ontario. We're talking about pan-Canadian community that has the same goal of ensuring that Canadians are getting the healthcare with the resources that we have.
The one thing that really jumps out at me as well is you're talking about your solution in an existing hospital today. Here in Waterloo Region, we're going to get a new hospital, 10, 15, some number of years away from now that we'll get a new hospital, hopefully sooner than later. Do you see the potential with your solution not just to optimize existing infrastructure, but then planning out a new facility? I was talking to some of the people who were on the committee for the new hospital, and one of the interesting things was this idea of do you need a waiting room in a hospital? Right now we have a waiting room because there's a delay in triage or whatever you need to do in an emergency room. Is there a potential to say, hey, you could do triage from home and then they'll tell you to come in 30 minutes? Do you see the potential here to say, hey, as you're building out the space is very expensive per square foot space in a hospital, you need this many additional, recovery beds versus this many surgical units?
Absolutely. So the solution that we developed is part of a suite of solutions that look at hospitals without wall. and hospitals without all the infrastructures that goes into it. And it's a thinking to say, what is it that needs to be done in the hospital? And for those things, how efficient we can be so that we can lower the footprint required for that hospital. And we're seeing technology being developed daily to fill in the gap to get us to this point. But more immediately, and where we are working right now, is getting the solution not just in the hand of the hospitals in terms of planning their surgeries and their schedules, getting the solution into the hands of health authorities and payers within Canada to look at their plan in the long term. What's the ideal incentives? What's the ideal policies to ensure that these efficiencies are implemented? And where do we send the patients for what types of surgeries that have better efficiencies that can improve our throughput and can improve our efficiency and effectiveness? So we're looking at the exact same solution, a digital twin solution to forecast and to help health authorities plan the patient journey better.
Yeah, how's that done today? If you need a surgery, like if you need a specific cardiac surgery,
Not great. That's
well, yeah. I mean, but it's an interest. Like, how do they know to send you to London versus Toronto or?
There are a few centers dedicated for certain things. There are trauma centers. So if you happen to have need trauma surgeons, there are certain centers around the province that are dedicated for that. But where patients don't necessarily know the options for things that are less critical, something like hip and knee replacements. There's a lot of people on the wait list not knowing that they can go to a different hospital or a different region within Ontario and they can get surgery in a much faster time frame.
It's like knowing to go to Goderich to get your passport.
And it's so much.
Pro tip.
It's so much luck too, because it depends on your referring physician. So your referring physician typically has a preference towards particular surgeons and will refer you to the surgeons that they know and like. And so then those popular surgeons have longer wait lists.
So there's basically no shortage of opportunity for technology to swoop in and solve a ton of problems or challenges or backlogs for all of us.
Nice way of putting it. Yes, thank you.
Way to wrap that in a bow, Rosie.
You just gave me a really good idea because I'm going to get the audio from the pitch and I'll put it in the episode.
Sweet.
Well, listen, thank you so much. I know we're kind of getting close to the actual showcase time, so we've got to wrap this one up. But thank you so much for joining us today. It's really inspiring to hear about this, and I always like coming away from one of these where I have a cool fact to drop at a party later. So I'm going to definitely use that cost center versus revenue comparison.
Oh, it's a big one. So like
It's Matt. I never thought
for
about
every
it.
single technology, right? Like because the people seeing the ROI are not the same people who are spending the money.
Yeah.
Yeah.
Yeah. Thank you for having me. This is a great conversation.
Thank you, JP. Thank you, Stacy.
Yeah.
I learned a lot on that one.
I learned a lot about the use of fax machines. It's 2025. Why?
But there's so much stuff that uses fax machines still. Like, it's wild they still exist.
I know I'm an elder millennial, but still.
Oh, I remember. Like, my dad had a fax machine, and I thought it was the coolest thing. And like that weird thermal paper
There's just so many other ways.
of doing anything. Yeah. All right.
That's why we're here.
Right here. That was a really great interview. The thing that I think I said it 2 times during the interview is I never thought about the difference in how Canadian hospitals and U.S. hospitals look at patients, cost center versus a revenue center, which kind of goes to the benefits of the Canadian healthcare system versus the one south of the border.
Right. Yeah, no big difference for sure, and something to keep in mind, but also really appreciated how he talked about balancing innovation with some of the operational realities, let's say, of healthcare in general.
Yeah. It's a lot like watching The Pit on Crave. Shout out to Crave. Thank you for listening to this episode. If you have any questions about Communitech membership or programs like Fast Track Health, you can visit communitech.ca to get connected with someone on the team who will help you and guide you to the information that you need. Also, this episode is brought to you by Elevate IP, which is an amazing program brought to you by the feds. I can't say the feds, can I? This program is also brought to you by Elevate IP, which is an amazing program for tech companies across Canada to get information and insights on how you can leverage your IP, protect your IP, make money off your IP, all the fun stuff. Elevate IP is facilitated by Communitech, Invest Ottawa, and North Forge. And just for everyone's records, none of those organizations are agents of the Crown. They are independent corporations in their provinces.
Trying to find a room in.